Is there anything like that you think coming down the pipeline to replace colonoscopy, or are we just, resigned to have to do this every 10 years for the rest of our lives?
Sure. Great question. And we could spend a lot of time talking about this, and we can. I would come at it from a different perspective, which is to say, from my perspective, the test is so high yield and so important that whatever that price is to do so, the prep, the day off of work, the diet beforehand, really is nothing compared to the potential of a misdiagnosis, right, that we could deal with. There have been different modalities over the years, starting with people that used to just test the stool for microscopic blood, or doing little exams called sigmoidoscopy, where we only go up a little bit to look for malignancy in the rectum. Colonoscopy now is decades old. It's tried and true. The prevention data is really clear. And the reason is because not only do we identify precancerous lesions called polyps or adenomas, but we remove them. And it's the removal of those lesions that makes it so they can't grow over a period of time. Now, the most recent thing down the pipeline has been the Cologuard, right? Which is a stool DNA test.
They're in my office every month or two.
Yeah, I'm
bringing
sure.
me lunch.
The reps.
Oh yeah.
So I could give you my entire spiel on Cologuard, right? I think there's a role for lots of different testing.
Right.
What I would say about Cologuard is a few different things. The most significant thing I like to talk about in this regard, because we talk about options in the office when I meet patients for colon cancer screening. First of all, if you're at all an increased risk patient, you don't qualify.
Right.
So if you have a family history of colon cancer, if you have family history of certain types of polyps, you don't qualify. If you have symptoms, you don't qualify. If you have had polyps before, you do not qualify. All right. But what I say is, I do colonoscopy however many 1,000 times a year.
Right.
And I hope that I never find colon cancer.
Right.
That's not the point of a preventative strategy in healthcare. Cologuard's big claim is they detect 90 some odd % of cancers.
Right.
Again, that's not preventative to me.
Right.
Preventative to me is finding the polyps, taking them out before they become